Question 101. The nurse is assessing a patient admitted to the hospital with rectal bleeding. The patient had a hip replacement 2 weeks ago. Which position should the nurse avoid when examining this patient's rectal area? A. Sims. B. Supine. C. Dorsal recumbent. D. Semifallus. Answer A. Explanation. Sims position is typically used to examine the rectal area. However, the position should be avoided if the patient has undergone hip replacement surgery. The patient with a hip replacement can assume the supine, dorsal recumbent, or semifallus positions without causing harm to the joint. Supine position is lying on the back facing upward. The patient in dorsal recumbent is on his back with knees flexed and soles of feet flat on the bed. In semifallus position, the patient is supine with the head of the bed elevated and legs slightly elevated. Question 102. How should the nurse modify the examination for a 7-year-old child? A. Ask the parents to leave the room before the examination. B. Demonstrate equipment before using it. C. Allow the child to help with the examination. D. Perform invasive procedures, for example, otoscopic last. Answer B. Explanation. The nurse should modify his examination by demonstrating equipment before using it to examine a school-aged child. The nurse should make sure parents are not present during a physical examination of an adolescent, but they usually help younger children feel more secure. The nurse should allow a preschooler to help with the examination when possible, but not usually a school-aged child. Toddlers are often fearful of invasive procedures, so those should be performed last in this age group. It is best to perform invasive procedures last for all age groups, therefore this does not represent a modification. Question 103. The nurse must examine a patient who is weak and unable to sit unaided or to get out of bed. How should the position the patient to begin and perform most of a physical examination? A. Dorsal recumbent. B. Semifallus. C. Lithotomy. D. Sims. Answer B. Explanation. If a patient is unable to sit up, the nurse should place him lying flat on his back with the head of the bed elevated. Dorsal recumbent position is used for abdominal assessment if the patient has abdominal or pelvic pain. The patient in dorsal recumbent is on his back with knees flexed and soles of feet flat on the bed. Lithotomy position is used for female pelvic examination. It is similar to dorsal recumbent position, except that the patient's legs are well separated and thighs are accurately flexed. Feet are usually placed in stirrups. Fold sheet or bath blanket crosswise over thighs and legs so that genital area is easily exposed. Keep patient covered as much as possible. The patient in Sims position is on left side with right knee flexed against abdomen and left knee slightly flexed. Left arm is behind body, right arm is placed comfortably. Sims position is used to examine the rectal area. In semifallus position, the patient is supine with the head of the bed elevated and legs slightly elevated. Question 104. The nurse should use the diagram of the stethoscope to auscultate which of the following: A. Hot murmurs. B. Jugular venous humps. C. bowel sounds. D. carotid bruits. Answer C. Explanation. The bell of the stethoscope should be used to hear low-pitched sounds, such as murmurs, bruits, and jugular humps. The diaphragm should be used to hear high-pitched sounds that normally occur in the heart, lungs, and abdomen. Question 105. The nurse calculates a body mass index, BMI, of 18 for a young adult woman who comes to the physician's office for college physical. This patient is considered A. Obese, B. Overweight, C. Average, D. Underweight. Answer D. Explanation. For Downs, BMI should range between 105 and 25. BMI less than 105 is considered underweight, BMI 25 to 29.9 is overweight, and BMI greater than 30 is considered obese. Question 106. The charge nurse asks the nursing assistive personnel, NAP, to give a back bath to a patient with end-stage chronic obstructive pulmonary disease. How should the NAP proceed? A. Bathe the patient's entire body using 8 to 10 washcloths. B. Assist the patient to a chair and provide bathing supplies. C. Saturate a towel and blanket in a plastic bag and then bathe the patient. D. Assist the patient to the bathtub and provide a bath chair. Answer A. Explanation. A towel bath is a modification of the bed bath in which the NAP places a large towel and a bath blanket into a plastic bag, saturates them with a commercially prepared mixture of moisturizer, non-rinse cleaning agent, and water, warms in them in a microwave, and then uses them to bathe the patient. A bag bath is a modification of the towel bath in which the NAP uses 8 to 1060 washcloths instead of a towel blanket. Each part of the patient's body is bathed with a fresh cloth. A back bath is not given in a chair or in a tub. Question 107. For a morbidly obese patient, which intervention should the nurse choose to counteract the pressure created by the skin folds? A. Cover the mattress with a stripped skin. B. Keep the linens wrinkle-free. C. Separate the skin folds with towels. D. Apply petrolatum barrier creams. Answer B. Explanation. Separating the skin folds with towels relieves the pressure of skin wrapping on skin. Sheepskins are not recommended for use at all. Petrolatum barrier creams are used to minimize moisture caused by incontinence. Question 108. A client exhibits all of the following during a physical assessment. Which of these is considered a primary defense against infection? A. Fever. B. Intact skin. C. Inflammation. D. Lethargy. Answer B. Explanation. Intact skin is considered a primary defense against infection. Fever, the inflammatory response, and phagocytosis, a process of killing pathogens, are considered secondary defenses against infection. Question 109. A client with a state 2 pressure ulcer has methicillin-resistant Staphylococcus aureus MRSA counted from the wound. Contact precautions are initiated. Which rule must be observed to follow contact precautions? A. A clean gown and gloves must be worn when in contact with the client. B. Everyone who enters the room must wear an N95 respirator mask. C. All linen and trash must be marked as contaminated and sent to biohazard waste. D. Place the client in a room with a client with an upper respiratory infection. Answer A. Explanation. A clean gown and gloves must be worn when any contact is anticipated with a client or with contaminated items in the room. A respiratory mask is required only with airborne precautions, not contact precautions. All linen must be double-bagged and clearly marked as contaminated. The client should be placed in a private room or in a room with a client with an active infection caused by the same organism and no other infections. Question 110. A client requires protective isolation. Which client can be safely paired with this client in a client care assignment? 1. A. Admitted with unstable diabetes mellitus. B. Who underwent surgical repair of a paravalvated bowel. C. With a stage 3 sacral pressure user. D. Admitted with a urinary tract infection. Answer A. Explanation. The client with unstable diabetes mellitus can safely be paired in a client care assignment because the client is free from infection. Perforation of the bowel exposes the client to infection requiring antibiotic therapy during the post-operative period. Therefore, this client should not be paired with a client in protective isolation. A client in protective isolation should not be paired with a client who has an open wound, such as a stage 3 pressure user, or with a client who has a urinary tract infection.
Thank you for watching.